Hello, my name is Karen Garrett, and welcome to our office. We wish to do everything we can to make your visit enjoyable and your treatment a success. This video will describe many of the things you need to know about the most current treatment options for varicose and spider veins. Whether dealing with small cosmetic spider veins or the largest varicose veins, your treatment will be safe, effective, and almost completely painless. Before we proceed, it's very important to understand that all veins are not treated the same way. Treatment must be specifically planned to best solve an individual patient's problem. Therefore, prior to describing the different treatment methods, it's necessary to discuss some specifics about the type of veins and vein disorders that are commonly encountered. Patients with vein-related problems seek treatment for one of two reasons: cosmetically troublesome spider veins or symptomatic varicose veins. While most of the time spider veins and varicose veins represent two different conditions, it's often possible and often the case that they are in fact the same condition with just different signs and symptoms. Therefore, even if a patient is only seeking treatment for small, unsightly spider veins, an assessment must be made to make certain that the same condition that causes varicose veins is not the hidden cause of the spider veins. Most people have heard the phrase about just being able to see the tip of the iceberg. This common expression about just seeing the tip of the iceberg applies in many cases of vein disorders. Another way to look at problem veins is to compare veins to rivers. Just like larger rivers flow into smaller rivers, larger veins flow into smaller veins. It would be impossible to dry up a small river if the larger river that is flowing into it is not dried up first. This principle has become the rule of successful vein treatment. Whenever veins are treated, it is very important to treat the larger feeder veins since they flow into and fill up the more obvious smaller veins or branches. This holds true whether dealing with spider veins, which are fed by larger blue veins in the skin, or varicose veins, which are fed from hidden veins just under the skin surface. It's important to understand that when treating veins, what a patient can see is often less than what really needs to be treated. After your evaluation, your doctor or healthcare professional will explain the details of proper treatment based on the findings. If you have a suspicious history, symptoms, or physical findings, it is likely that you will have a Doppler examination. This is a painless examination in which a small electronic-type stethoscope is used to hear the flow of blood in the veins. Remember, effective vein treatment involves not only treating the obvious problem, but also depends upon treating the source, which is often not obvious or is hidden under the surface. Remember the iceberg comparison. If your problem turns out to be only cosmetic in nature, you will be referred directly for treatment without any further testing or evaluation. If you have varicose veins, or if your examination is suspicious for a hidden problem in which larger veins are feeding into the surface veins, then an ultrasound examination will be recommended. Ultrasound is a valuable tool used to diagnose and define the exact nature, anatomy, and source of the vein problem. Once the ultrasound has been performed, a more specific and detailed treatment plan can be recommended. Hidden feeder veins, which are the source for the more visible veins, can be identified and treated by using ultrasound to guide the injection into the hidden veins. This technique, which is referred to as ultrasound-guided sclerotherapy, is often used by many vein specialists as part of the treatment options available to a patient. Not every patient with large or small veins will need an ultrasound examination prior to treatment. In many cases, patients are immediately given their options for treatment, and in some cases, treatment can begin on their first visit. This is particularly true if the problem proves to be only of a cosmetic nature. Treatment of cosmetically undesirable veins is both safe and effective. The two most common and well-accepted techniques for treating smaller veins are injection sclerotherapy and light energy or laser treatment. While the use of highly sophisticated technical devices such as lasers has lots of public appeal, these techniques have not proven to be better than sclerotherapy, nor are they a substitute for skillful injections. The technique of injection sclerotherapy has been around for almost 100 years. Sclerotherapy of undesirable veins has become one of the most popular cosmetic procedures performed in doctors' offices. It's safe, effective, and practically painless. Using a tiny needle, not much larger than a human hair, fluid is injected into the undesirable vein. Because many of these veins are right on the surface of the skin, the needle barely penetrates the upper skin layer, causing less discomfort than a mosquito bite. Once treatment has been performed, you will notice several things. Immediately after treatment, it is very common to have small areas resembling hives or mosquito bites. This occurs at the sites of the injections. These are harmless and are usually gone within hours or by the next day. The veins that have been injected may look red or even slightly swollen. This is evidence that an injury has occurred to the vein and should be considered a sign of effective treatment. For the next week or so, there can be small bruises at the injection sites. Even though the veins appear to miraculously disappear when injected, they will come back and for the most part look normal for the next several weeks. For best results, smaller veins should be treated gently with the expectation that they will fade slowly over 4 to 6 weeks. With sclerotherapy, time is a friend, not an enemy. Your veins did not appear overnight, and they will not go away overnight. Complications from sclerotherapy are rare and fortunately seldom serious. However, minor side effects are common. It's normal to expect some temporary itching, mild swelling, and bruising. This all settles down relatively quickly. After a week or more, some, but not all veins that have been treated will often appear darker or more visible than they were prior to treatment. When veins that have been treated begin to close down, small amounts of blood are often trapped inside the vein. This blood has no way to escape and becomes darker. Eventually, this blood will be absorbed. Occasionally, a tender lump is associated with trapped blood within the vein. This is not a clot and is totally harmless. If at least 2 weeks after your treatment you see areas where the veins are very dark, bring that to our attention. Trapped blood can cause some temporary brown staining of the skin. This usually goes away within 3 months, but occasionally lasts longer. Another common side effect of treatment is a condition called matting. Matting appears as small red areas near the treatment sites and is due to the formation of tiny new blood vessels. This is nothing more than the human body's normal way of trying to heal when an injury has occurred. The chance of matting is less than 5%, and it can often be treated and improved with either more sclerotherapy or laser therapy. Another minor risk when undergoing sclerotherapy is that of skin damage. This is rare, and fortunately when it occurs, it's usually nothing more than a small, shallow scab. Next to be discussed is the treatment of a medical condition called venous insufficiency. The biologic purpose of our veins is to direct blood flow back to the heart and lungs. Blood is directed through the veins by a series of one-way valves. The function of the valves is to keep the blood in place and prevent it from falling back down the leg while being directed to the heart. Venous insufficiency is the result of the improper function or failure of the one-way valves. In this case, the blood can move in either direction and, as with any liquid, will simply fall back down the vein toward the bottom of the leg due to the effect of gravity. This results in an abnormal amount of pressure compared to normal veins. This pressure, created by the flow of blood in the wrong direction, causes portions or branches of the vein further down the leg to become widened and distended. Venous insufficiency is the underlying cause of varicose veins. However, many people with smaller veins on the leg that think they simply have a cosmetic problem can indeed have underlying venous insufficiency. Whether dealing with large varicose veins or smaller cosmetic appearing veins, venous insufficiency is considered a medical condition. Symptoms associated with venous insufficiency are swelling, discomfort, skin changes, phlebitis, and occasionally skin ulcers in the lower leg. When venous insufficiency is associated with smaller surface veins, sclerotherapy, often using ultrasound to first treat the hidden veins, is an effective method of treatment. In this picture, a hidden feeder vein is being treated using the ultrasound-guided injection technique. This technique is safe and effective when performed by an experienced clinician. Remember, the proper approach to treatment of all vein problems is to first treat the larger veins that feed into the smaller veins. This makes the treatment of the smaller veins more effective and more permanent. Patients with large visible varicose veins can be treated in a number of ways. It's possible to use injection sclerotherapy on larger varicose veins. A relatively new, very effective and efficient way of treating larger varicose veins is by performing a procedure called ambulatory phlebectomy. This technique involves the removal of the bulging veins through tiny puncture-type incisions in the skin. This can be done in the office under local anesthesia. The phlebectomy procedure, combined with either ultrasound-guided sclerotherapy or the new catheter ablation procedure, is making vein stripping obsolete. Even the largest surface veins can be removed with a phlebectomy procedure. A bandage is worn for about a week. Recovery is immediate and patients can be back to work or doing most normal activities the very next day. Since the veins are physically gone, recurrences are rare and there are few side effects. Because the phlebectomy procedure only treats the surface veins, the hidden source veins still need to be treated. This can be accomplished by either injecting them using the ultrasound-guided technique a few weeks after the phlebectomy or by destroying them at the very same time that the phlebectomy is performed. Many patients prefer the convenience of having the surface veins and the hidden veins treated all at once. Combining the newest vein treatment option, the ablation procedure, with an ambulatory phlebectomy results in a one-step procedure to effectively treat varicose veins, often in an hour or less, with once again just a one-day recovery. The ablation procedure involves placing a small catheter in the vein through a puncture no larger than a freckle. The vein is made numb with a local anesthetic, and then energy is delivered inside the vein through the catheter. This energy can either be in the form of radio waves or laser light. The energy heats the inner lining of the vein and causes an injury to the vein that makes it close off and eventually disappear. When the ablation procedure is combined with a phlebectomy, oftentimes no additional treatment is necessary. A one-step procedure can be performed to treat even the largest varicose veins right in the office. The combination procedure is the most modern, safe, effective, and efficient way to deal with varicose veins. In summary, modern treatment of cosmetic spider veins and varicose veins is safe, effective, and involves almost no downtime. Even if a patient just seems to have small veins, it's always necessary to make certain there is not more present than meets the eye. Hidden, larger veins associated with a condition called venous insufficiency, which is the same condition that causes varicose veins, sometimes only shows up as small veins. Your doctor or healthcare provider will make certain that even if you just have small veins, there is no underlying or hidden venous insufficiency. If venous insufficiency is suspected, it will be diagnosed and treated appropriately. If your problem is deemed to be of just a cosmetic nature, treatment, usually in the form of injection sclerotherapy, will be discussed. Treatment for larger varicose veins has progressed to a stage where almost all varicose veins can be treated in the office by combining a variety of modern techniques. This allows for the safe, effective treatment of even the largest veins with little to no downtime. We hope that this video has been both informative and enjoyable. Please feel free to discuss any concerns and questions with our staff. Thank you for putting your confidence in our practice.